My name is Randy Bigley. Joining me on the podcast right now from the Community Health Access Project is Nancy Hartman. Good morning, Nancy.
Good morning.
The Community Health Access Project, what is that?
That is, the acronym for Community Health Access Project is CHAP.
Mm-hmm.
So some people may be familiar with CHAP. CHAP has been around for over 23 years, and it is a nonprofit agency, a 501c3, that provides services to community members who live in one of the 6 counties that CHAP covers, which is Crawford, Richland, Ashland, Morrow, Knox, and Huron.
Okay.
And those services could be anywhere from a pregnant mom needing to be connected to an OBGYN, lining up with a pediatrician, diapers, wipes, baby clothing, from a then pediatric who needs to be connected also to a pediatrician, and their well child visits and their immunizations, and then for the adults, helping them with their submitting their social security application, connecting them to a specialist, say they have a specific disease. It's that community health worker who is helping them get connected to those resources. So CHAP has partnering agencies, and within all of our partnering agencies, there's a community health worker or more than one community health worker. And that community health worker who is working at that agency then goes out and does home visits with the clients and anyone else within that family. The Pathways, it's called the Pathways Community Health Model, and the hub model is to do a holistic approach to the entire family. So let's say we get a referral in for a pregnant mom. Mom is living with grandma and grandpa, aunt or uncle, has multiple children in the household. The community health worker is primarily starting with helping the mom, but can also help everyone else living in that household. Because everyone else living in that household could be having risk factors that need to be mitigated. They are out of a job. They need to see a specialist. I mean, the risk factors of everyone in that household could be impacting the health of the mom and the unborn baby. So the community health worker then holistically looks at everyone living in that household and helps everyone mitigate their risk factors.
Oh, wow, okay. So they kind of help, she'll figure out what's going on and get them send them in the right directions where to go, right?
Correct.
Yeah.
Coordinates transportation for them, coordinates if they need food, clothing, if they need help with their utilities, getting them connected to the resources that can help them with those risk factors, those basic needs that they're having trouble meeting.
Wow, is there any cost to this at all?
No, it's all free.
Wow. Very cool.
It's all free.
And,
we get referrals from individuals that call in or come into our office. We get referrals from agencies within the community. And then we also get referrals from our Medicaid managed care providers, CareSource, Buckeye Molina, United Healthcare. And then we get referrals from like Ohio Health, Avita, or when they have, or even a counseling service. If they have a client that they're working with and they see that they have a lot of risk factors, then they will refer that client to CHAP, and then the community health worker will reach out and connect with that individual and help them get their risk factors mitigated.
So medical and mental and physical, all that, right?
Right.
Yeah.
The community health workers do not do anything clinically related. They just get them connected to the resources that they need. So it's very important that the community health worker lives in the community that they're serving, because they then develop that relationship and that trust. For example, if someone is hesitant about getting a vaccine, they may go to the doctor may talk with them about it, but they're still hesitant. If they have that trust and relationship with a community health worker, then that community health worker can help them, and they trust them, that they're leading them to the right resources and making the right connections.
And you have them in every county, or that you named off, right?
We have mostly our community health workers are in Richland County.
Okay.
We're looking for partnering agencies that would be interested in partnering with CHAP to have a community health worker within their organization.
Okay.
And right now we have several Crawford County community members that we're serving. They are being served by a community health worker in Richland County.
Okay.
But the model, the Pathways Community Health model, is designed for the community health worker to live in the county that they're serving, because that makes the connection easier.
Sure, right. Yeah.
And the relationship much better, and they're more aware of all the resources in their own community. Where a community health worker in another county would need to learn where all the resources are at.
Sure. So you're looking for people too, probably, right?
Looking for organizations that would want to hire a community health worker, and or they might even have someone on staff that's doing similar things as a community health worker. They are helping their community members get them connected to diapers and wipes, and getting them connected to transportation. So any organization in Crawford County that's is doing that, someone in their organization could actually become a certified community health worker. And when I say certified, we have a training that we provide funding for the individual to attend the certified community health worker training, and they are certified by the Board of Nursing, Ohio Board of Nursing. Okay. So it's a 3-week training, and then after the training, then they receive their certificate, and then they have to recertify every 2 years.
Okay. If there's an organization that might be interested in partnering with you, how can they do that?
They can call our office, which is 419-526-CHAP. So CHAP spelled, and the numerical for CHAP is 2427.
Okay.
And then my email address is director@chaphub.org, and that's CHAPHUB.org.
And what counties were that again? Did you say?
CHAP covers Crawford, Ashland, Richland, Morrow, Knox, and Huron.
Okay, so if you're in those counties there, and you're an organization that would like to partner, that's right.
Please reach out, yes, because you actually probably have someone within your organization doing these very similar things as a certified community health worker, and going through our being a partner with CHAP would also be very beneficial.
All right. Well, Nancy, thank you so much. What a fantastic organization you have there.
Well, thank you. It was started by Doctors Mark and Sarah Redding, and they have now taken their Pathways Community Health model, and it's being implemented all across the United States.
Wow, so cool! Yeah.
So there's about I see like 19% of the counties in Ohio that are not yet covered by a Pathways Community Hub, and that's what CHAP is. There are 11 certified hubs in Ohio. And then the Pathways Community Hub model, the Reddings, and their organization, they create another organization. So the Reddings created CHAP in Mansfield. Okay, they started in Mansfield, and now they are implementing their model all across the United States. So they're in 11 states now, helping communities in those states start a Pathways Community Hub and start helping their community members address their social determinants of health, getting their risk factors mitigated. The other organization that they started is the Pathways Community Health Institute, PCHI, and that's where then any community all over the United States, they contact PCHI if they're interested in starting a hub. So I know I'm doing a little thing, but the Reddings, they're just very wonderful people, and they live in Richland County. The late Dr. Mark Redding was a pediatrician, and we are just carrying on the work that they started.
Thank you so much, Nancy.
Sure. Thank you so much for asking us to be here.
Anytime. Thank you.